Well, much like so many of the other communities in our nation, Louisville's felt the pain of the opioid addiction and the halo effects that come with that from crime and from despair. And obviously, we understand that a healthcare system has a responsible role to play in that. Some of the intervention strategies that we've endorsed in our market have been everything from lobbying for changes in prescribing habits for physicians around narcotics. We've also believed that as many of those types of narcotic drugs as we can get out of the home and out of the house is a good thing. So we have sponsored and participated in take-back programs where unused narcotics, opioids, can be disposed of properly. Just in one of those efforts, we were able to recover around 700 pounds of narcotics. So we believe that those are all efforts that begin to scratch the surface there. We also have invested in a program called New Visions, where we work with addicted mothers who are recently pregnant and hopefully can intervene early enough to help them with that addiction so it doesn't affect the baby in any way, and work with them on lifestyle even after delivery to make sure that the baby is taken well care of and that they have a lifestyle that they can take care of the baby in a proper way going forward. So there are many things that we have to do as a healthcare system and as an industry to begin to chip away at this problem. I don't think that any one of those is going to be the answer to the equation. And I do think that it is one of those societal issues that we have to understand why people turn to opioids and why they turn to narcotics. Unfortunately, it's become even more complex with the addition of fentanyl. Because as we know, fentanyl is a very dangerous drug. It's a very dangerous drug even when administered properly by professionals and must be used carefully. But in the hands of others who are mixing fentanyl with what used to seem like a harmless drug to many on the street, or those marijuana users who never saw anything that was blended into the mix, fentanyl there can become lethal instantly. Well, I think the recognition and the understanding of the depth of the problem is the first step, and I do think we're there. I think that most communities nationwide understand what a drain this is, not only on resources, not only on the police force, not only on the healthcare providers, but on the society as a whole, that we've now identified it, we understand it. I think that we're all struggling a bit as to how to bring a quick remedy to this, when in fact there may not be a quick solution. This has to be a well thought out, well funded, well strategized long-term theory. I think the federal government is beginning to understand the plight of the hometown and the opioid addiction crisis. There's been some good things funded. We've been very fortunate to have the Senate Majority Leader Mitch McConnell from Kentucky be very helpful to us with some funding around educational programs and the programs that I've discussed earlier. So I think there is an understanding and beginning to be some traction around it. But this is not one that can be solved in a year. This is one that, if we're going to have an impact and move the needle, is going to be a generational sort of appeal and approach for us to be consistent and stay with it and begin to find ways to get those narcotics off the street, to not have physicians overprescribing. And to understand that as a society we have to be very cognizant of when drugs do make it on the street and when they become in a contraband sort of way available, that we have to get after it quickly.